Hello everyone, I am Bella and welcome to Sunway Eye Center page. Today with me is one of the recently joined ophthalmologists at Sunway Eye Center, which is Dr. Peh Khaik Kee. Hello doctor, how are you?
Thank you, thanks, I'm fine, thanks very much.
Alright, thank you for joining me today so that we can get to know you better. Alright, perhaps you can tell us about your background and your journey of becoming an ophthalmologist.
I completed primary and secondary school in Malaysia and only left for the United Kingdom to do medical school. And I completed medical school in Aberdeen University and subsequently travelled around the UK completing my postgraduate program. Started off after finishing my housemanship by doing accident and emergency locums and then trained in orthopedics actually. Then halfway through orthopedics, I made the decision to switch to ophthalmology. During basic training, I also undertook a 2-year medical retinal fellowship. Following that research fellowship, that's when I started registrar training. So during registrar training, I also completed 2 surgical retinal fellowships. One in Perth, Western Australia, and the final one was in Oxford. In 2015, I was approached by a headhunter and they made me an offer to join Singapore.
Oh, okay.
Yeah, so that's where I spent the last 5 years in Singapore as a consultant ophthalmologist and vitreoretinal surgeon.
What has driven you to specialize in eyes?
I think the long and short of it is I enjoy surgery. So I really enjoyed orthopedics, but I found that the thing I enjoyed the most was hand surgery because it's very intricate. To my mind, I thought, okay, let's push this further a little bit and try something even smaller.
Oh, okay. So, you like the challenge then.
So therefore, I decided to let's try eyes. I've been at it for the last 15 years now.
Can I know, doctor, where are you from?
I'm from KL originally.
Okay.
Yes.
Okay. Is there any interesting story from any of your procedure that you have done before?
Yeah, I think every procedure is a journey in learning. There's one procedure that stands out in my mind. This was a very eminent professor in Oxford University who had a retinal detachment. During the procedure under local anesthesia, everything that could go wrong went wrong. Number one, I had a junior start the surgery and things didn't go quite to plan. And then secondly, I had equipment failure. You have a patient who is under local anesthesia, and this patient was helping me solve the issues with my surgery. And even after that, once he had recovered and the retina was successfully attached, he then developed a cataract. Surgery was difficult in his case, but the initial calculation of the lens power was wrong. So there was an error made during the measurement of the lens. And this resulted in him being much more short-sighted than when he first came to see me. He had an implant which was the wrong power. I had to find another surgical solution for him. Well, in the end, it all worked out very well. He regained his driving vision. A few weeks after the end of his last procedure, another patient turned up and asked, "Are you Dr. Peh?" And I said, "Yes." He says, "Oh, because so-and-so recommended that I should see you." And I was shocked. It was that patient. So this eminent professor where everything went wrong, but in the end came good. Despite all this, he still recommended his neighbor to see me. When I reflect upon that, there were a lot of learning points from that. Number one, take responsibility for the patient's care. Be totally transparent with the patient. And a lot of patients will understand why you're doing the things you're doing. Nothing is exact. Things do go wrong, even despite our best efforts. I use this patient as a learning point for my medical students as well and the trainee surgeons.
Alright, this is a bit personal, but can I know what are your hobbies when you are not working as an eye doctor?
I play tennis, and since I've been back, I've been swimming a lot more.
Okay, now
because it's nice and warm.
Yeah.
I also enjoy motorsports. So once in a while, I do go to Sepang to participate in open track days and it gets things out of the system.
Yes. Okay, so we are about to end our session.
Thank
Is
you.
there any take-home message that you would like to share with the viewers of that?
Get your eyes checked regularly. There are a lot of eye conditions now that in the past could not be treated. There are many therapies available now, but they're not curative. However, if you screen early and pick up these problems early and start treatment, you can prevent sight loss.
Alright, doctor, thank you for joining me today. We will have more videos on Sunway Eye Center page, so stay tuned for our next video. Bye bye.
Bye. Thanks.